morning, everyone, and welcome to the 19th annual St. Martin's Health Fair. I want to let everyone know how happy we are to be able to have this time together, and thanks to the students in advance for their what I know is going to be wonderful presentations. I have here Pastor Father Kelly, who's going to say just a very few words.
Ta-da! Good morning. I think I'm down on the floor here. Well, Sunday mornings are busy. I already have one baptism. We're getting ready to set up for church for 12 o'clock. We do it live and online. So but thanks again. I mean, people have been blessed for like 19 years. This is wonderful. So you're part of a long history of folks from Georgetown have been helping keep my church people healthy. So thank you so very much. And I look forward to watching what you've presented when I see the, what do you call it, the replay? That's it. So thank you, thank you, thank you.
All right. Okay, we can get started. I will turn it over to Dr. Chaya.
Thank you, Charlene. Hi, everybody. We're excited to host this year. First of all, we'll have general preventative care recommendations by Grace and Kieran. We're very excited to do this. But we have a couple of very fun, useful, practical demonstrations coming up. So stay tuned.
Okay, so I can share our presentation on preventative care. Oops, sorry. Okay, so my name's Kieran, and along with Grace, we're going to be talking about preventative care recommendations by age group. The recommendations for everyone from their 20s, 30s, and 40s is relatively standard. So for women, it's recommended that about every 3 years you receive a pap smear, and this can be more frequent if you have an increased risk for cervical cancer. It's also recommended that everyone over 20 is receiving a cholesterol screening about every 5 years. Again, this can be more frequent depending on your family's history. And then if you're above 45, or if you have a BMI, if you're younger but your BMI is above 25, it's recommended that you receive a diabetes screening about every 3 years. And then for women over 40, you should be getting a physical breast exam every year. And then depending on your risk, if you have a family history, for instance, you might want to start mammograms in your 40s, and so you should discuss this with your physician. Additionally, all ages should receive a blood pressure check about every 1 to 2 years, and everyone should have an annual teeth cleaning to ensure proper dental health. And then for your 50s, again, women should be receiving mammograms, and this is every 2 years from the ages of 50 to 74 if you're at an average risk of breast cancer. However, for women with increased risk factors, such as a family history, you should ask your doctor about starting screening either earlier and potentially more frequently. And then all genders should be receiving colorectal cancer screening starting in your 50s. And this can either be colonoscopies or can include newer colon screening techniques. So you should discuss with your physician about what's right for you. And then everyone should receive either their shingles vaccine and, of course, your annual flu vaccine.
Hi, everyone. So I'm Grace. I'm going to finish up the preventative care presentation by talking a little bit more about some other age groups. The recommended preventative care and screening exams for those in their 60s. Number one, include continuing with some of the screening tests that we've already talked about, such as mammograms, pap smears, colorectal cancer screenings, and a few other things we wanted to mention that are new would be osteoporosis screening for women 65 years and older. That's usually in the form of a bone density scan, and osteoporosis essentially is a condition that can lead to a higher risk of getting like fractures or other kind of bone issues. And then another new one would be the abdominal aortic aneurysm, or AAA screening for men who have smoked. And this is men who are currently smoking or have, smoked at like a previous period in their life. And that would just be an ultrasound of the abdomen. We also wanted to mention hepatitis C screening. So this is more for kind of people this age. I think the recommendation is people born between 1945 and 1965 to get a hepatitis C screening. And we also included the pneumococcal vaccine. That's for a type of pneumonia, mainly the annual flu vaccine. And this one is not a screening exam, but we just wanted to include at 65. That's when Medicare eligibility begins. And then for those in their 70s, 80s, 90s, and beyond, we did kind of one slide because the screening here is generally consistent across these age groups. But for screening exams in your 70s, some people may actually be able to discontinue some of the screening tests performed during, the 50s and 60s, depending on, family history or findings on previous exams. So that's just a conversation to have with your doctor or whatever providers has been ordering those exams. And a couple other things we wanted to put is the depression screening. This has become especially relevant with COVID. We are seeing higher rates of depression in people in this age group. And we just wanted to include it because, even if people don't have a history of diagnosed depression before, or, may not necessarily feel, sad or kind of notice a, sudden change or anything, it's something to talk to your doctor about, especially with the kind of quarantine isolation we've seen in these times. And then another thing to point out in this age group is it's recommended to increase protein intake. So just being conscious of, am I getting that that protein from like, salmon or chicken or Greek yogurt, just kind of trying to include like a high protein source, or add in kind of a new protein source into the balanced diet. And we've provided, I'll talk a little bit more in the next slide, but some resources for that. And as always, the annual flu vaccine. All right, so this is just a slide on how to be your own health advocate. And before we go through these, I just wanted to talk a little bit about the screening exams that we talked about in the previous slides. So screening tests are things that we do regardless of like symptoms. Like they're for conditions where studies have shown that the benefits from catching conditions at when they're asymptomatic or when you feel completely normal have shown to improve health outcomes or treatment on these conditions. So these are things to do when you feel totally fine, just kind of routine things to make sure to talk to your doctor about. And yeah, okay. And a few things we wanted to mention were that we definitely recommend going through your family history with your doctor. We listed some medical conditions here that you could inform your doctor if you know of any relatives who have had these, such as heart attack, stroke, cancer, dementia, diabetes, high blood pressure. And this is because they may impact recommendations for preventative health screenings or tests, such as, like we talked about with mammograms and breast cancer. If you have, say, a mother, sister, aunt, or multiple family members on either side who've had breast cancer, they might recommend you begin mammograms earlier or have them more frequently. And even if you have no medical conditions in your family that you know of, that's an important thing to tell your physician as well. We also included some questions you can ask your doctor at your next appointment, including what preventative services or screening tests should I get? Am I at an increased risk for any diseases or conditions? And that is, especially important in the context of, say, family history or smoking or things like that. And then another good one is, what should I be doing to live my healthiest life? And we also wanted to mention that there are some medical conditions where we don't have good screening tests. We can't necessarily screen for everything with just a physical exam or blood test. And this is where it becomes important to keep in contact with your healthcare provider if you develop any new or concerning symptoms. And we listed some down here that people might not necessarily think to, inform their doctors, such as unintentional weight loss and fatigue. So if you, experience any of those, just give your provider a call and say, hey, I'm feeling like this. Maybe they recommend you come in, or maybe they'll kind of, bring it to a provider and call you back with some more recommendations. We also included chest pain, blood in the urine, stool, or coughing up blood. Another one would be vaginal bleeding after menopause. But anything that's just kind of new, concerning, you're like, this feels off, we recommend calling your doctor and just letting them know what's going on. And we'll also be sending along the various screening tests and recommendations that we talked about in this presentation in the form of a checklist by age group, as well as a document with some resources, including lists of a few primary care providers in the area and their numbers. If you don't have an established relationship with a primary care phishician, those are some offices where you could go. We also included some just resources for diet, exercise, information about the screening tests we talked about today in that document. So that just about wraps up our preventative screening and healthcare presentation.
Will there be a question and answer period?
We can. Should we do that now or at the end of all of them?
Why don't we just see if there's a few? Yeah, why don't we just see if there's a few questions, and then we can move on.
Okay.
Anyone have any questions?
I have a question. In your first slide that you presented, you gave some parameters for routine checkups, and I noticed that one on your slide for hypertension, annual checkups once or twice in a year. Was that an error, or is that what you're recommending? Especially since 47% of Americans have hypertension over 130, and African Americans 54%, which is a silent killer. I work with clients every day that are hypertensive, which affects their kidneys, their overall health. Did you really mean to put 1 to 2 times annually a year?
I can go ahead and answer that, Essie. So this is the Uspstf guidelines for normal people, that have never had any diagnosis, not for hypertensives on medications, or have diagnosis of hypertension. So for them, usually the screening the follow-ups can be every month, every 3 months. So it depends on the provider and management. and how well controlled they are. But you're absolutely right on the statistics that it is the #1 silent killer, often causes heart attacks and strokes. But this is like general population 21 and above that have never had any kind of medical issues. That's why we're calling it preventative care.
Yes, absolutely. All of these things will change based on, diagnoses and history. Like, for example, if someone is diagnosed with breast cancer, they'll be getting a variety of scans a lot more frequently. And that's kind of up to the doctors managing that care.
The other question I had was heart health. Due to heart health, you didn't mention the idea that women are often overlooked for stress tests. Also, I noticed in your dentist's grid, one annual check of cleanup. Shouldn't that be biannual, especially for heart health in certain age groups?
Yeah, so like Dr. Kasaraneni said, our guidelines come from the United States Preventative Health Task Force. I think those were all of the components of the name of that committee. And that's basically a committee that outlines what are kind of basic recommendations and what insurance will cover. Some physicians will recommend additional screening and more increase or different tests. And that's why it's really important to have that established relationship with a primary care physician and let them know, your family history, talk to them about risk factors. And yes, you're absolutely right that women are overlooked in terms of heart disease and, are kind of thought to present more like atypically. And that's a conversation to have with your doctor as well, especially if you have, say, relatives who've had, heart attack, stroke, chest pain, that kind of thing. And with chest pain to, let your doctor know if that's something you begin experiencing. But in terms of just preventative, asymptomatic, baseline care recommendations, that we're not provided with any guidelines from the preventative task force in terms of things that are recommended for everyone globally. Is that correct, Dr. Kasaraneni?
Yeah, I agree with that.
So the grids that you just presented is sort of, it's not tailored to the community that you're speaking to, because in the area in which you're speaking to, the highest percentage of breast cancer in the Washington, D.C. area, that is one of the wards that has the highest percentage. Hypertension, another high percentage. So the grid that you presented is a generic grid. Is that correct?
It is the basic recommendations. You're correct. It is for a worldwide population. It is not tailored to like the specific community, but this is the bare minimum, because even with breast cancer, we would only still do once a year mammogram. It would only be covered for dental checkups only in a certain way. So that's what we're covering. This is the bare minimum that you actually have to go to the doctor for. Does that help?
And I would also say that our community does have many different people in it, not just one type of people. So,
Right. Point well taken. However, to be more beneficial in helping those that I see daily in that community benefit from your presentation, I think you could adjust it and put some variance in it to be.
That's true. I think we need to move on to the next topic, though. Thank you very much, Essie.
Yeah, thank you so much. And that's something that could be incorporated next year or updated. And yeah,
we'll put it into next year. Yes, thank you. All right, next we're going to have a demonstration on how to take good blood pressure at home. So go ahead.
So I think I was going to put on the slides for these. Do I have permit? Yeah, I do. Okay. Everyone see that okay?
We're good.
Hang on.
Thanks, Joseph.
Sorry. Just 1 second.
All right. Hi, everyone. My name's Tyler. I'm here with Joseph, and we wanted to talk to you about doing a blood pressure demonstration today. All right. So before we get into it, I just wanted to kind of highlight some key aspects of why it's important to know how to take your blood pressure correctly at home. So as you could probably imagine, it's really important to get accurate information so that you can tell your physician about how everything's been going for you. Not taking your blood pressure correctly can kind of make you have a false sense of security that everything is going well with you when it's something a little bit more sinister may be happening underneath. And also just on another level, just to spread awareness to loved ones and family and friends about how to properly take blood pressures themselves. All right, so here are just some things that we pulled from the Mayo Clinic about some of the key takeaways on how to properly take a blood pressure test from home. So you want to make sure that you sit down with your feet fully on the ground and you're at rest for about 3 minutes before you're taking your blood pressure to make sure that there's no anomalies of you getting up and walking around as your heart rate and blood pressure can fluctuate because of those. When you're ready, you want to make sure that you're relaxed and that your back is against the back of the chair. So you can't be in a stool, you have to have a back to your chair. And you want to make sure that you have your arm on a table, preferably at the same height as your heart, and that your hand is facing upwards. You want to also have that blood pressure cuff situated about 1 inch above where your elbow is. And you want to make sure that it's decently tight and that your arm is bare. So you want to make sure that you're not wearing any clothes and that there's no barrier in between your cuff and the skin. You also want to make sure that to be able to tell if the cuff is tight enough, you can try like a little test where you can put 2 fingers in between and make sure that it feels appropriate to you. And then when you're ready to start, go ahead and press the start button. And I think one of the big takeaways from this is you want to make sure to write down your numbers. Doctors like to see how you're doing, if there's any major fluctuations, and depending on what your doctor may recommend, he may say to take it more than once. If you feel like it was really high because you were a little bit anxious, go ahead and take it again, but just make sure to write it down. All right, and here was just a little infographic that we put some of the big things to watch out for when you're taking your blood pressure from home. So you want to make sure that you're silent, your bladder's empty, your feet are on the ground, you're relaxed with your back against the back of a chair, arm at heart level, and that you're making sure that you're using the proper cuff size. And yeah, Joseph, if you want to take it from here.
Yeah, sure. So the main thing to take away from this slide is that you want to be relaxed while you're taking your blood pressure. That applies to your posture, that applies to what you did right before, and what you're doing during. So you don't want to be actively having a conversation. You don't want to be particularly tense. Like Tyler said, you don't want to be on a stool or anything like that. You don't want to be having to maintain your posture. You want to have a good comfortable position with your arm at heart level and not be actively performing any activity really. If you have to think about if you're holding your arm up off the table or holding yourself up or focused on something else, then that could throw off your reading. Another note on the posture is that you should keep your legs uncrossed and flat on the floor like Tyler talked about. And then one more thing I want to mention is that it's absolutely critical that you don't put the cuff over your clothes because that will entirely throw off your reading. So it should be on your bare arm, and you want to make sure to use a blood pressure cuff that fits well around your arm. If it's way too big or way too small, then your reading is going to be no good. So just to reiterate some of that, having the correctly sized cuff is very important. Good posture is important. And then I also wanted to mention the rest period. So like Tyler said, 3 minutes, I've also read 5. The important thing is that you're not actively doing something and then go sit down and take your blood pressure immediately, because it will be elevated if you do it that way. You want to sit down, you want to rest for a couple minutes until you feel comfortable, until you feel at rest, and then you go ahead and take your blood pressure. And then some other things that can affect it. One big thing is your fluid intake. So this is a massive oversimplification, but just to make it clear, you know, fluids that you ingest will end up in your circulation one way or another. So if you have a full bladder, if you've just drank a ton of water, had a lot of caffeine, then you may see an elevated blood pressure from that. So, and then my last point was just about distractions again. So actively talking, or if you're in pain for whatever reason, if you have back problems or anything like that, and the position you're in is uncomfortable, that can affect your reading as well. And then finally, you should always be taking it at the same time of day. It doesn't really matter what time of day you choose. It can be first thing in the morning, it could be before you go to bed. But your blood pressure is going to fluctuate a little bit throughout your normal day. So if you take it today, first thing in the morning, tomorrow at lunch, and the next day at night, you'd expect some variation there. And one of the key things that we're looking for when we're measuring blood pressure is to see that it's consistent. You know, any major fluctuations are always a red flag for you or your physician. So in order to avoid like a false indication, you want to take it at the same time every day consistently, so you know what your personal trend actually looks like. Yeah. And then we have a video here on how to do it. Just they're going to go ahead and show you. So see if I can get this to play.
To monitor your blood pressure using an automatic blood pressure monitor, find a comfortable place to sit with good back support at a table or desk. When you're ready to take your blood pressure, sit quietly for 3 to 5 minutes beforehand. Place your feet flat on the floor and rest your arm on a tabletop, even with your heart. Lean against the back of the chair. Stretch out your arm, palm upward. Place the cup on your bare upper arm, 1 inch above the bend of your elbow. Make sure the tubing falls over the front center of your arm so the sensor is correctly placed. Pull the end of the cup so that it's evenly tight around your arm. You should place it tight enough so that you can only slip 2 fingertips under the top edge of the cup. Make sure your skin doesn't pinch when the cup inflates. To get started, wait a moment, then press start. Remain still and quiet as the machine begins measuring. The cup will inflate, then slowly deflate so that the machine can take your measurement. When the reading is complete, the monitor displays your blood pressure and pulse on the digital panel. If the monitor doesn't record a reading, reposition the cup and try again. Rest quietly and wait about 1 to 2 minutes before taking another measurement. Record your numbers either by writing the information down or by entering the information into an electronic personal health record. Some monitors can upload your blood pressure readings automatically.
All right.
To monitor your blood pressure.
And that's all we have for you today on blood pressure. So if there's any questions, we'll take them now.
What is it? Okay. Okay, I have a question.
Sure.
Hello?
Go ahead.
Okay, it says some of these situations will increase your blood pressure, like if you don't sit quietly or things. Where will you see the increase, on the upper number or the lower number, or overall on both?
It's typically on the upper number.
She's in the upper. Oh, okay. Okay, thank you.
And I wanted to reiterate a couple of points that it's important to relax, and coffee, smoking, things like that do increase. So make sure you're getting your blood pressure checked a couple of different times during the day, at least at the initial step of diagnosis. And the other thing I always tell my patients is to bring their home blood pressure cuff to the or the machine to the clinic, so that we can do a comparison between our clinic numbers and the ones that they're doing at home. So even if it's lower while they're at home, to make sure it's getting the correct reading. And then next we're going to have Rolando and Casey go ahead and present on common misconceptions of the amount of salt and sugar in our foods.
All right. Hello, everybody. Rolando and I are going to be presenting on the amount of salt and sugar in common everyday foods. Our outline for today, we're going to look at the most common foods that are found in corner stores, and then how much salt and sugar are found in these foods. And then we'll wrap it up with what does this mean for our bodies and health. So the reason we're focusing on corner stores today instead of grocery stores is because particularly in DC Ward 7 and 8, there's not really a whole lot of grocery stores. You can look at table 3 here, and towards the bottom, it shows there's only 2 grocery stores in Ward 7 and only 1 in Ward 8. And Ward 5 is also below the average. So this means that a good amount of the population who are living in these areas are more or less forced to use fast food and corner stores for their main source of nutrition. So here's like just kind of a sample list of the kind of things you would find in corner stores or fast food restaurants. And all these numbers can, for the amount of sugar and the amount of salt, can be found on the back of the products with the other nutrition information. But we realize it's kind of just like numbers at this point. So to get a little bit more hands-on, we measured out some of the amounts of salt and sugar in these foods. So of course this works better in person, but I can show you now if we, yeah. So I think my face needs a little green thing around it. Let's see.
I think you're good.
Okay. All right. I'll just continue then. So here is your recommended salt intake. It's about 5 to 6 grams. And it's really not a whole lot. Here's a pen for scale. So that's as we go through the foods, just kind of keep this amount in mind. It's not a whole lot. So first up, we have some potato chips, and I think the ones mentioned on the slides were Lay's, but it's basically the same thing. And they have this much salt in them, which isn't the full daily intake, but it's getting pretty close already. And then we also included Cheetos. And they have just about the same amount as the chips did. And yeah, so then another thing we included is a McDonald's Big Mac and fries, which, as you would expect, has even more salt. And we also wanted to include some frozen foods. So I think the one mentioned in the slides was the Weight Watchers, one of the Weight Watchers microwavable meals. And because of preservatives and things like that, they also have quite a bit of salt in it, even though it's like advertised as a healthy food product. Kind of same thing with Lean Pockets, also have a good deal of salt. And then we also wanted to include canned vegetables for kind of a similar reason. Due to preservatives and that sort of thing, they have more salt than you would expect, which isn't a ton here, but more than fresh fruits and vegetables would have for sure. So then moving on to sugar. First up, we have soda, Coca-Cola. And there's quite a bit of sugar in here. It's pretty hefty, and like imagining all of this just in a drink is pretty amazing. not in a good way either. And then for Arizona iced tea, it's almost the exact same amount as a regular Coca-Cola drink. So yeah, even though the branding might be a little bit better and say that it's like more healthy, it is about the same amount of sugar. And then next up we have candy bar Snickers here, and a hefty amount of sugar as well. And last up, we're returning to the Big Mac and fries again, which at least for me isn't a food that I would immediately associate with like a sweet flavor. It seems more like savory to me, but there's actually like quite a deal of sugar in a Big Mac and fries meal from McDonald's. So that was particularly surprising to me. Yeah, so that's all our demonstrations we have, and Rolando is going to take it away with what this means for our bodies and health.
Yeah. All right. Thanks, Casey. Can everyone see the slides again?
You're good.
Yeah. Okay. So what does this mean? So particularly for sugar, we kind of hit this weird or kind of vicious cycle with sugar. So on the left there, you can see that if we eat food, in response to eating food that has sugar, as we saw Casey showing, like just like that Snickers bar, quite a bit of sugar in there. And so our pancreas will actually make some insulin in response to that sugar. And over time, as this kind of keeps happening, it can actually cause for our own cells that usually use that sugar or that glucose to convert it to energy for us to kind of just move our arms, kind of just, live our daily lives. So over time, we get that resistance to like that insulin. And most of the time that extra like glucose or sugar gets converted to fat or actually gets eliminated. And we'll talk about some issues that happen with that. But like over like a long period of time, you actually start to feel tired and hungry. And then you tend to then again eat more food in response to that because you're not feeling, satiated, you're not feeling like you're full at all. So it kind of hits like this vicious cycle over and over again. And why that might be is kind of like we showed with the corner stores for that graph or this figure on the right. We see that, carbohydrates are going to be things that increase our blood glucose. And it's not a great graph in showing like which ones are better or worse, but really we just want to highlight that bottom part there, that the sweet foods and snacks. So these are going to be like the Snickers, the Arizona iced tea, the potato chips, Cheetos. Those are the things that we're going to be finding in our corner stores. And it's kind of going to lead to this vicious cycle. And if left unchecked, we can actually develop diabetes, specifically type 2 diabetes, with this kind of unchecked, high consumption of glucose. And, some symptoms we can see with diabetes is, we'll see some swelling in the hands, feet, in the eyes, shortness of breath. You start to feel really tired. You have to, pee a lot, so frequent urination. And then you can actually lead to some blood pressure issues as well. And, with diabetes, as it kind of progresses and kind of remains unchecked, it can lead to some further complications in which it starts to actually, the high amount of sugar that's in your blood, the high glucose content, starts to, damage some of the blood vessels in your eyes, for example, and that may cause blindness, cause diabetic nephropathy, so it actually causes some damage to the kidney. So it kind of leads to that frequent urination. And it can also cause damage to nerves. So you start to see that numbness of the toes and fingers. And, some of you may know folks who have had to have like amputated, feet, for example, because with that loss of damage or that damage of nerves, any kind of foot ulcer can easily become infected because they don't really feel that pain. And it can lead to, gangrene and, the amputation. And, that's kind of what we don't want to see. And for salt is a little bit trickier. So I like this kind of graph on the left here, where we have a kind of increased salt intake. And I mean, there's a lot of arrows and stuff, but just kind of keep it simple. If you just, continue to eat a lot of like a high salt diet, we actually can end up having, kidney stones. It can actually cause like an increase in calcium reabsorption and actually cause for your bones to become a lot more brittle and, develop osteoporosis. It can actually cause like an increase in parathyroid hormone, which also adds to the increased calcium reabsorption for our bodies. And then it can also cause the hypertension, which hypertension, as we learned earlier, is the silent killer, right? And this is kind of like the link we want to do between the food and, you know, these diseases, specifically hypertension. And actually, one thing to kind of touch base on with salt, I like these myths that this graph to the this figure to the right shows, where like that second one says salt is not a big deal if you don't have hypertension. And really, it's like too much salt can actually lead to hypertension. So it's not like if you have hypertension, yes, you have to watch out for your salt intake, but in any general person, whether you're healthy or not, you have to watch for your salt intake because it could develop to hypertension. You don't want to layer that on top of any other issues you may be having. There's also, I know like there's been like this big rebranding of like the pink Himalayan salts. That's like the healthier table salt, but really it's still salt at the end of the day. So it's going to have a high sodium content. And another thing, I like that fifth one where, you know, with food without salt, it just tastes gross. Like, well, I mean, there are some other alternatives, right? You can use herbs, you can add, you know, chili powder, ginger, garlic, coriander. You can use different seasonings that don't have as much salt or limited salt to kind of flavor your food. So you don't have to sacrifice flavor so much by adding some seasonings to it. And with the salt intake, you know, here like we don't expect everyone to like listen to this and just automatically cut out all salt from their diets, and nor should you, right? The recommended daily dose, as Casey said, was 2,300 milligrams, and you know, the average American diet allows for about 3,400 milligrams, and it'll probably be higher in certain communities because, like we said, if you're relying on corner stores with a lot of these processed foods, it's going to be much higher than the average, right? But what I like about this figure, though, is that, you know, they found that if you just reduce the amount of sodium you consumed, right, the amount of salt you consumed in one day by 1,000 milligrams, that can go a long way. So if you just reduce it by 1,000 milligrams, you know, we would actually prevent 35,000 new heart attacks each year and 23,000 new strokes just by reducing it by 1,000. Not even completely eliminating it, just by following. Actually, it's even like 100 milligrams greater than the recommended level, but just by reducing it, you know, these small changes can go a long way. And that was really the thing that we wanted to highlight. And I don't want to just like leave it as doom and gloom. Like I know DC Central Kitchen, they have their Healthy Corners initiative. And so I know that they're trying to incorporate a lot more fresh vegetables and fruits options in different corner stores in DC because they realize this is a problem. And as we know, like, you know, wealth is health, and they're trying to combat a lot of these poor options in these corner stores by just allowing them to have fresh foods or fruits and vegetables. So, you know, definitely as options kind of become more available in these stores, you know, definitely seek them out. I know it may be difficult at first, but, you know, like I said, the small changes can go a long way. And with that, that ends our presentation, and we're going to be hearing about some exercise mobility by Chiari and Longo. Oh, wait, sorry. Also, we have the Q&A session. Yeah. So we'll hear some questions if anyone has any.
Lango and Chiari, feel free to take it away. So they're going to discuss some mobility exercises to keep you guys moving and active, and the importance of them.
Can everyone see my screen?
Yes. Oh, wait, we lost it.
There we go.
Now we see it.
All right, perfect. Good morning, everyone. My name is Lango Sachizia, and Chiari and I this morning will be presenting on morning routines and mobility exercises. I'd like to start off with a little quote by Lemony Snicket, which says, "Morning is an important time of day because how you spend your morning can often tell you what kind of day you're going to have." And I'm sure all of us can relate to this to some extent. You know, how we start our day can have a significant impact on how the rest of our day goes. And the million-dollar question becomes, is there an optimal way to start your day? So if you take a Google search, I'm sure you'll find lots of headlines of how Bill Gates or Obama start their day. And it's a very interesting question because I'm sure all of us wonders, like, is there a way I can make the most of my morning, and can that impact the rest of my day? So this study or this survey that I've shown here asked several Americans one activity that they deemed essential for starting their day. And as you can see from the results of the survey, there's a wide spread of activities, with coffee being the number one, essential part of people's mornings. So to answer this question, is there an optimal way to start your day? Scientifically, no, there isn't, because we are also different. What might work for me might not work for you. But with that said, if you are looking to increase your energy, creativity, and productivity, we have a few suggestions for you, things you can incorporate to your daily routine. So one of the first things we're going to suggest is every morning, just having a glass of water. So as we rest, our body's in a state of fasting, and just taking in some water early in the morning is one of the first things you do, can help rehydrate you from that nightly dehydration. The second thing that we recommend is some sort of morning reflection. So this could come in the form of checklists. Checklists are very powerful because as you cross out the different activities and things that you planned, it kind of gives you an uplifting feeling like you're getting things done. It gives you a form of momentum to push on for the rest of your day. So as we said, some form of reflection. So checklists with goals or plans for the day. It could be 3 gratitudes or 3 things you want to accomplish. Anything along those lines, just as long as you're getting your mind active and working to think about the day ahead. We also strongly encourage movement, and Chiari is going to get into more details about that. But just anything to get your body moving early in the morning is a great thing. And one last thing that we're going to recommend is actually purchasing a physical alarm. And the reason for this is because I'm sure we can all relate to this. For most of us that use our phones as an alarm, as soon as your alarm rings, you're either doing one or 2 things: pressing the snooze button or picking up your phone and flicking through all the notifications that you missed over the night. And this can result, in you spending 30, 40 minutes in bed on social media, responding to emails. And although, these are things that have to be completed, I think it's better to give your brain and body time to, adjust to the day, time to wake up before getting bogged down with, all the updates that are on your cell phones. So I'm going to pass over to Chiari, who's going to talk a little bit about mobility exercises.
Hey, everybody. It's good to see you again. So, as Lango said, there's not really like a perfect way to start your day. Can you hear me? Sorry, just double check.
Yes, you're fine.
Yeah, thank you. But I believe, personally, I believe that exercise is a great way to finish or end your day. It doesn't really matter when you start. It just depends on your personal preference. And I'm gonna start off with the quote from Gene Tinney. He was a heavyweight champion, a boxer in the early 1920s, 1900 to late 1920s. And so he says that exercise should be regarded as a tribute to the heart. And so I guess I think even though we didn't understand about the heart as much as we do back then, but he knew that, like the heart is one of the most important organ of your body. And that's because it stopped pumping from the minutes it's formed in the womb until, when we move on, when we die. And so what he's trying to say is the best thing you could do to your muscle, to your heart, is exercising. And so if you exercise your heart, you make it stronger, and that means it's able to pump blood more efficiently. So if you have a weak heart because of diseases or just being overweight, it takes more time and more effort to pump blood, which is not it's not good for the muscle, because eventually it can worn out like any other muscle of your body. And also as we all know from what Rolando also touched on, heart diseases are one of the biggest issues not just in the United States, also in the world. And by 2035, it's estimated that 1 in 2 Americans will have a heart-related disease. And then economically, that will cost us around $1.1 trillion. That is more than the economy of Mexico and Indonesia, just to put in perspective. That's a lot of money. That's also more money than the United States spend on the defense system. So I'm going to start off with a few exercises that you can do at home. They're very easy, and on this slide I've included the set, the reps, and the time for each exercise, and all the exercises put together shouldn't take more than, they should be 30 to 45 minutes. Longo, do you want to go to the next slide? So the first one exercise that we're going to start with is shoulder exercise. As we all know, with age comes a lot of back and neck pains, and this is because as we age, we tend to gain weight and we lose flexibility and stability. And so the best thing you can do for your back and your neck is strengthen those muscles that are on your back and your neck. And the best thing to do is any exercise like shoulder press, which from this image, what they show you doing them with weight, but you can do it with anything. You can hold a water bottle on each side and get a sit comfortably in your chair and follow the maneuvers. And then the exercise number 2 also target your shoulders and also your chest. And like I said, you should aim for 2 to 3 reps, and the whole exercise shouldn't be more than 4 minutes, including the rest. And like I said, this help maintain your upper body function, and it has increased range of motion. And also another added benefit on top of strengthening your muscle is weight loss. And then the next one will be chest. So chest workout is one of my favorite workout, and because everything we do, like when you lift anything, when you hold and push anything, you use your pectoralis muscles, which are on your chest. And the best way to strengthen these muscles is to work on your chest. And there's a lot of different form of exercise that you can do at home. And from this image, they showing some chest presses, and you can use the same equipment, water bottles that you use for your shoulders, so you can transition directly. Another effective exercise is push-up. And if you're stable or strong enough, you can do it without a chair. You can do a knee push-up, or you can do with one knee or no knees at all. And the goal here is to be comfortable, but also make sure that you're not injuring yourself while you're exercising. And as like I said, the best thing for one of the benefit of working your chest is strengthening your pectoralis muscles, which we use for almost every activity that involves the upper body. And then we'll move to arms. So arms, this is a little bit more self-explanatory. The stronger your arms are, the better performance you have in every aspect of your life. For example, you can't do the shoulder or the chest press if you have weak arms. So the more strengthening your arm translates to better performance on other exercises and also your daily exercises, which like even cooking, carrying grocery or anything. So that's why I like arm exercises, and they're very easy to do. And you can also use you can target the bicep and tricep using just good old water bottles, and also doing push-ups also strengthen your arms as well. And then so the next exercise, we're moving to the lower half of your body. And so the first one will be calf raises, calves. So, and they're very underrated. A lot of people don't think about calves when they think about exercising or lifting weight, but your calves are very crucial when it comes to the strength of your ankle and your feet. And like I said in the beginning, with age comes a lot of mobility issues, and a lot of there's also you have ankle or foot issues, and a good way to prevent that is working on your strengthening your calves. And the next one will be seated leg extension, and this exercise targets your quads and your hamstrings. And so your quads are the biggest muscles in your body, and they're used in almost everything: jumping, walking, running, and as a result, they're very prone to injury. So for example, like one of the most common injury in sports, for like track and field or soccer, is tearing your quad muscles, which can be very painful. I experienced one a few years ago, but the best way to prevent like any injury to your quadriceps is exercising them, but very carefully. And also this exercise, if you can see, also involves your knee. So that means you also can improve your knee stability and improve the muscles around your knees. And also, just to be careful, like I said, quads muscle can be prone to injury, so it's very crucial that you stretch them and warm them up before you start exercising them.
And just to add a disclaimer, please don't, do any of these exercises without supervision, especially if you're just starting out, or talk to a physical therapist or somebody that can tell you what the proper posture is to avoid any injuries. Go ahead, Carrie. Sorry, I'll let you finish.
No, you're good. Thank you. And so the last, I wanted to leave the last for one of the most important exercise, which is squat. It is indeed my favorite, and it's also the easiest one to do, and it can also be the hardest. It's a very awkward exercise, and that's why for anybody who's never done it before, I think it would be great to start with a chair, like you see with these two ladies in the picture. And I consider squat to be the king of all exercises, because everything you do to the squats translate to every other exercise, or both your lower and upper body muscle. And also, if done incorrectly, it can end up harming your knees and your lower back. So it's a very good exercise, but it can be a dangerous one if it's not done, if you're done unsupervised or with incorrect form. And I'm gonna keep repeating this. And with age come a lot of neck and lower back pains and knee pains, and this lead to a lot of mobility issues. So if you have knee or lower back pain, then you move less. And so the good thing about squats is they strengthen your lower and upper body, which improve your flexibility in those respective part of your body. And and you can do it with anything. The best way to start doing a squat, which how I personally started, was without weight. Even when I started undergrad at Georgetown, where I ran track, the first thing they make us do is do squats for like at least 2 weeks without any weights, just so you can learn how to do them. Because like I said, it can be a very awkward exercise, but it's very, very beneficial. And once you get comfortable with it, it's good to start lifting what you'll be comfortable with. Like I say, you can start with water bottle. You can hold water bottles, like the way the lady's putting her arms together. Her palms together. You can put water bottles. You can also hold a bag of rice on your shoulder, and or something not too heavy, and get on the squat position and do a few sets. And so before I finish, I want to, as the Dr. K emphasized, with all of this exercise can be very helpful. One of the most issue in America is the fact that we don't move that much. We have a lot of us have limited movement because of our jobs or any other activity that we do. So it's crucial that we spend a few minutes of our day exercising, but also you want to make sure like you don't want to injure yourself in the process, because that means now you can't exercise or you can't continue with your daily activities. And thank you. I'll take any question from now. If anybody got a question about any of the exercises?
I have a question. I have a sedentary position, and I used to be a track and field runner, basketball. However, the only exercise I do now is fork, knife, and spoon. And I've noticed that my muscle mass is depreciating with age as well. Can you rebuild muscle mass? And if so, what exercise would be a good one to do?
Okay, so I'm gonna try to answer the best I can, but I'll let Dr. K also give her input. As you say, I think like I mentioned, with one of the thing that comes with age is like we lose our muscle mass and muscle tone as we age, and exercise is the only way that we can keep the muscle strength. Like you cannot grow new muscles, but you can make them stronger. You can increase like the mass of your muscle, but you can't grow new ones. And exercise is the best way to increase their strength. And for example, your arms, I think, like I said, any tricep, like bicep curls, those would be the best exercise you can do for your arms, because they can't, even though they mostly target your bicep, they also they will work on your tricep. But the problem with the tricep extension is they can be they cannot on your joint rotation. They can strain your joint, but bicep is not as hard for you for bicep curl to strain your joint. And for the upper body and lower body, I think squats will be very good for your quads and your knees. And any chest exercise, whether it's push-ups or chest press, is a very good chest for you. It's a very good exercise for your pectoralis muscles. And running, I think it's a good exercise for everything. The goal is the good thing about running is it just strengthen your entire body. It's not targeting any muscle specifically, but it helps with the weight loss, which can translate to other aerobic exercises like weightlifting. And I hope, Dr. K, do you have anything to add?
Yeah, let me jump in. So to build muscle, Essie, I would say, monitor your protein intake for sure, because if you're not eating properly, you're not getting enough nutritional protein. And it doesn't have to just be meat. It can be beans, it can be, tofu, soy has good protein. Greek yogurt has good protein. So just making sure that every meal you're getting some protein in, which is easier said than done, but to kind of retain it. And in addition to what Carrie was saying, I would say walking is probably the best, just depending on the body size. Just because some people may not run. Like, I've never been able to run in my life, but I can walk for miles. So it just depends on what you can do. And any movement is better than to retain that muscle mass. Is walking, I would recommend.
I'm currently on a ketogenic diet or routine. I've changed I'm reprogramming my entire diet. I have a history of arthritis, osteoarthritis. So I'm removing inflammatories out of my diet by going keto. And so the only thing that I would not do, I was a runner, but now I walk because of the impact on the knees. Thank you.
Yes, that's perfect. Yeah. Thank you. All right, now we move on to one of the most important topics I know the community had been looking forward to dealing with children's mental health during the pandemic. Christian and Phil has some very good information on it, things I've learned just in talking to them. So go ahead, take it away.
Okay, let me share my screen. All right, so Phil and I will be discussing the impact of COVID-19 on children's mental health. That said, so first and foremost, I do want to mention that COVID is driving a children's mental health emergency throughout the United States, but also worldwide. And it occurs directly and indirectly. And what I mean by that is, for instance, though most COVID-19 deaths occur among adults, more so than children, a tragic consequence of adults' deaths is that a number of children might actually lose their parents, grandparents, or a close family member and caregiver as a result. I'm going to throw like a little stat at you, but there are many stats similar to this that have come about during this pandemic. So for instance, in 2020, the proportion of mental health related emergency visits among adolescents ages 12 to 17 years old increased 31% compared with that during 2019, which is quite significant because mental health related emergency visits might be a result of, a failed suicide attempt, a psychiatric emergency, or a issue with or a moment of like self-harm. So overall, there is a sharp increase in mental health related problems. The ones that we see most often include anxiety, depression, and intentional self-harm. Which brings me to this emotional wheel, which I introduced to you all in my first presentation. And I think it's just, again, a very, very useful tool for parents to have when communicating with their children. And a lot of children just don't have the emotional language at that age to be able to exemplify or say how they're feeling, and just being able to show them this wheel will help you in identifying what they're feeling, especially during a time of like social isolation, which COVID has brought about, and giving them a tool to share with you how they're feeling, so then you can take the next step necessary. So I do want to brush about adverse childhood experiences. This is a topic in itself and a presentation in itself, but I think it is significant because a child who does have an adverse childhood experience, which is, there are different ACEs, and they include abuse, which could be physical, emotional, or sexual abuse, neglect, which includes physical or emotional neglect, and other household dysfunctions such as, mental health illnesses, and incarcerated family members, substance abuse in the household, and even divorce. But all that being said, though adverse childhood experiences exacerbate the risk of mental health issues coming up during this pandemic, especially in a time when there is a lot of social isolation. Kids are removed from their structure from school and are now back home. And for instance, a kid who is at home and may not feel safe or comfortable may actually increase the risk of, self-harm or even risk of suicide, which and depression, which I have graphs on the right over here. So just keeping in mind that these adverse childhood experiences are a thing, and that they do exacerbate risk of mental health illnesses. Which brings me to helping children cope with stress during COVID-19. Phil will touch a little bit more about this, but what I briefly want to mention is just being aware of your child's demeanor, how they're acting. Every child is very different. Some will act more anxious, some will be clingy, some are more withdrawn, angry, whatever it may be. But as a parent or caregiver, just allowing yourself to be supportive and listening to their concerns, and just being attentive of how they're feeling, what they're saying, especially during this pandemic. It's especially important given, like I mentioned, a loss of structure. Not for some children, they're not going to school and not having a routine day-to-day structure, and also maybe losing that interaction, face-to-face interaction with their friends. So giving your time and maybe even setting up Zoom calls with their friends might be helpful. And Phil will go into a little bit about this a little bit. That being said, because I did talk a little bit about self-harm and risk of suicide, I do want to include here on the bottom left, there is a number that you could actually text, 988, which allows you to get in contact with someone who would help you, or if you find someone is at risk of suicide, to get them in contact with someone that can help. And then another terrific opportunity or endeavor in the Washington, D.C. community is this community response team, wherein you could call this number at the top left. And sorry, can you hear me okay? So in the top left, you could actually call this number, and it allows you to get in contact with a volunteer, a trained mental health specialist, and they'll be able to communicate with you in times of, distress, need, or whatever it may be. And I think these are just great opportunities to reach out to and have in the back of your pocket as well, in case you do need them in the future. For the sake of time, I won't play these videos, but UNICEF did a terrific little endeavor during this pandemic, where they actually reached out to a bunch of children throughout the United States, as well as to other countries in the world, and had video diaries of children during their day-to-day life during COVID. And I think it was just terrific. For instance, this top right is Zoe's little video diary of her in New York and what she does on a day-to-day basis, even though she's combating, for instance, social isolation and not going in for school, how she keeps busy. But then on the flip side, on the bottom right, I have a video of Muna, who similar, although she's in the Middle East, and what she does. And I think these are just videos that I highly, highly recommend you look into and actually watch. And there are so many other videos from all around the world that UNICEF put together, because it illustrates that, yes, COVID-19 is very present in the United States, but it is also very present in every single country throughout the world. And children are coping with it in very different ways, but the impact is still very similar amongst all of them and amongst us. So I want to,
Here's a,
but that's my part. Hold on, sorry. There we go. So now I'm going to lead it to Phil to talk a little bit more about combating, COVID-19 and then social isolation.
awesome. Thank you, Kristen. Good morning, everyone. So I'm going to pick up where Kristen left off and talk a little bit, sort of switch from sort of the impacts of COVID on sort of social isolation and mental health towards sort of some more solutions and ways that we can sort of work to maintain child mental health during these difficult times. And we'll start on a very positive note with something that we didn't have a year ago. A year ago, giving this presentation, we were in a much worse position, but now we have very effective tools to allow us to sort of get together in a, I think we all are a little bit tired of the term new normal, but sort of a new normal way. And the biggest one is COVID-19 vaccines. So this is another sort of moment to remind everyone that the COVID-19 vaccines are extremely safe and effective, and everyone should take the opportunity to get them and to get any of their kids or grandkids or any kids they work with who are over the age of 5 who are now eligible. And this really provides an opportunity. While earlier in the pandemic, there was sort of social isolation with really no solutions. Now, children and adolescents can safely hang out with friends, family, classmates, etc., who are also vaccinated. We also have, obviously, as we've talked about throughout this whole pandemic, we have masks. So if it's a sort of closed indoor environment, also during sort of a major COVID surge, as we've been dealing with the last few months, wearing masks is also another really effective way to enable children, adolescents, and adults, for that matter, to socialize and be together safely. Another really valuable sort of tool we have, if you want to call it a tool, is the outdoors and fresh air. Numerous studies throughout this pandemic have shown that COVID-19 is much less likely to spread outdoors versus indoor closed environments. Unfortunately, it's a little bit cold right now, as I'm sure everyone is aware. It might not be the best time of year for everyone to want to go outside. I can speak for myself. There's not much of outside that I want to be at right now. But there are just so many great fun opportunities to sort of do activities outdoors. I listed a few here: picnics, walking, running, skating, as I showed a picture. I know there's sort of a skating rink at the National Mall, which is probably a little bit crowded. I know there's also a few elsewhere in DC and in Virginia that may be a little bit less crowded. But just so many opportunities to spend time outside. And while today is a poor example because it's so cold outside, it's also it's good to just keep an eye on sort of the weather forecast and look out for some sort of slightly warmer days. For example, unfortunately, I think there may be a little bit of rain, so you might want to keep an eye on it. But I know in the middle of next week, like Tuesday, Wednesday, and Thursday, the temperature is supposed to go into I think the 40s and even 50s a little bit. So it might be a good time if you're sort of feeling a little bit isolated or a little bit down with the cold weather right now to maybe make a schedule, maybe reach out to some friends, some family about going for a walk or going for a run or having a picnic or whatever on one of those slightly warmer days. So unfortunately, for a variety of reasons, even with sort of vaccines, outdoor options, some people still may not be able to get together in person. Fortunately, we have tons of virtual options to stay well connected and to sort of maintain your mental health during this pandemic. I think we've all heard about these at this point, but there are so many virtual platforms, including FaceTime, Zoom, Skype, and many others that enable you to stay in touch with others. And I'll talk about this a little bit more later. But some of the things we really miss, like having meals with other people, sort of playing games with other people, etc. You can still do in a virtual setting if you sort of cook yourself a nice meal and prop up your phone or your computer or some device so you can maintain a conversation while you're doing so, is a really good way to stay connected and sort of mimic the activities that we normally would do in person that are unfortunately limited during this pandemic. And fingers crossed with vaccines and everything that we can get back to those. We can rely on these virtual options a little bit less going forward. In addition, I put down here some really fun virtual options for children specific, or not for children specifically, adults could enjoy these as well, but some things that I know children are sort of maybe a little bit more interested in, including video games, social media. Those are really great ways to keep in touch, to sort of have fun, to put a smile on your face, to get a laugh, etc. But obviously with all of those, it's important to remember to do those in moderation. And for parents, grandparents, caretakers, it's definitely important to sort of keep those platforms open for your children because they really are good ways to stay connected, but also keep them in moderation. I'll talk a little bit about scheduling in the next slide, but maybe block out 1, 2, 3 hours a day to allow your children to play video games with their friends, sort of scroll through social media with their friends, chat with their friends. It can be really healthy in moderation. And then just exactly what I just touched on, scheduling is really important. And I think it's always been really important to make schedules and to sort of, one of the earlier presentations touched on sort of making a checklist in the morning, which is a really sort of good way to start your day. But I think now it's really difficult when maybe you're not leaving your house to really maintain a schedule. So I think it's really important for everyone to sort of block different portions of their day for work, but also for exercise, as we've touched on, for cooking, as we've touched on, for maintaining connections, phone calls, etc. And especially right now for adults, for parents, grandparents, caretakers, to sort of build your schedule around spending, I put 1 to 2 hours every day, but it can be whatever you're comfortable with and whatever fits into your schedule to spend time with your children, your sort of younger family or friends, to build that time into your schedule. Because I think if you don't schedule, it can be really easy to sort of at the end of the day, just sort of say, oh, I had too much work today. I had this to do. And all our lives are extremely stressful, but just building that time into your day can make a world of difference, especially for everyone, but I think especially for children and adolescents who may be feeling especially socially isolated. And then at the end, I think it's just important to emphasize again for children and adolescents especially, but for everyone, that just familial and social support is more important during COVID than ever before. It's just so important to check in on your family, friends, neighbors, classmates, etc. You just can never be too communicative. Or maybe that's a little bit of an exaggeration, but it's just always good to communicate with others, to check in on how people are doing. So I think that's a good note to leave off on. And I think that is about it. Oh, sorry, I have one more slide, a really important one, and I totally mismanaged. This is maybe one of the most important slides. Virtual mental health resources. There are, I think everyone sort of has an image that that sort of, to look after your mental health, you have to be in person, you have to talk with people. That couldn't be farther from the truth. The pandemic has helped develop so many virtual options, and there are so many apps. I have some listed here: Mood Mission, Talkspace, MoodFit, Headspace, Calm, Depression, CBT, Self-Help Guide, and there are so many more that you can download Several of them are free, as I've mentioned here. There are options for different ages and different groups. And these are just tremendous resources that are so easy to use. If you're just having a tough day, you can just log on and get help right away, which is really one of the great perks of technology and cell phones and everything like that. So, thank you.
Thank you, Phil and Christian. We can take questions if anybody has any.
I actually have just one question. First of all, thank everyone. This is so interesting. It was for the salt and sugar. Like I said, with Rolando and Casey. Is there a daily recommended sugar intake amount? Like there is a sodium?
Yeah, so the current recommendation for sugar is about 50 grams, which seems like a lot, but if you look at just the Arizona iced tea, that had like 54 grams, I believe. So that shows quite a, like, your daily intake for sugar is basically in that one can of Arizona iced tea.
Yeah, I think that was the point I wanted to make sure got across to everybody. Okay, thank you.
Thank you. I think, Dave, we can stop recording.
I did want to address, so Angela, you had mentioned, what would you suggest as a virtual option? So there are so many different options in regards to just working with your kid and doing something. Something that came about that I heard of, which I think is terrific, is actually doing like a virtual museum tour that some museums offer, and doing that together with your kid, and maybe having them select which museum they're interested in doing that together would be a very beneficial little educational thing for both you and your child.